So welcome to the review for exam 7. I am going to just review some things and then we'll do a practice quiz. And we'll do this very efficiently because I've got things color-coded to help me know where to focus our time. Actually, okay, so we just have 2 units to review for this exam. Isn't that nice? Let's see. We'll look at the tables because the tables are actually probably your best study guide because they have pretty much everything that you'll need to know, with the addition of also including the issues. So we're just going to hit, and please be ready to highlight the things that I'm covering because those are the things you are going to want to focus on in your studies to prepare for tomorrow's exam. And let's see here. Okay. So with the school age, that is, we're going to just notice this little area here with physical growth. Remember that they start with a growth, the school age starts, their growth starts slow and steady, and it ends with a growth spurt. So it starts slow and steady and ends with a growth spurt, as noted right here. And we routinely check for scoliosis in school age kids. For gross motor, they should be able to ride a bike and, during their school age years. They become more graceful and improve their coordination. Early on in the school age years, they learn how to tie their shoes. And that's one of the last things that needs to develop as far as dressing themselves go, because they could do just about everything else in the preschool years. So that tying the shoes is like tying the bow on the gift. That's an important accomplishment. They also can write with and draw with more accuracy and smoothness, and they can learn to play a musical instrument, and many children, school-age children, do learn this talent, this skill during their school-age years. Okay, for psychosocial, this is Erikson's. Remember, there's always questions about the stages of development for the theorists. So remember, Erikson's is industry versus inferiority, and they develop this industry through task mastery. So that's really important for them in establishing a sound self-image of sense of identity through their industry and task mastery. They thrive on praise and recognition. They mostly tend to associate with same-sex peer groups, and they enjoy team play. They like that competition. They need a little coaching to help them to deal with losses if they're not always the winner. For cognitive skills, that's Piaget. They graduate to the concrete. They finish up with pre-operational stage. We didn't really talk about that too much with school age because we covered it so well in toddler and preschool. So mostly for school age, we focus on concrete operations, which is when they can grasp the concept of conservation. Remember, you pour fluid into 2 different glass shapes. It might have different heights, but it's still the same volume, and they finally get that. And let's see. They love hands-on learning. That kind of goes along with their task mastery. So they really like doing things that require their hands to manipulate and draw and do crafts and learn with really engaging, active, hands-on experiments like the volcano experiment that's so famous for this age group. It's important for them to have that hands-on. Discipline, they need to see how there are natural and logical consequences for their behaviors. And a good method to discipline is using timeout or grounding or removing privileges. Those are all better than physical punishment. And then for the moral development, they are in that during their school age year, they want to be nice to avoid a guilty conscience. That's stage 3 of Kohlberg's levels, and stage 4 is where they have that law of and order, that sense of duty and fair play. Let's see. For nutrition, remember that breakfast is very important. We try to encourage all school-age children to have breakfast, and they are still sometimes need snacks, and they do benefit from having healthy snacks. Issues, we'll get to that in a minute. First, let's go over comfort measures. These would be nursing cares for the hospitalized school-age child. We allow children to make their own choices. We encourage them to participate in making what decisions they can that are appropriate for them. And we also watch to see if they are, we like to give them opportunities to express their feelings. Sometimes they're hiding really deep concerns or fears. So we want to try to get those feelings out so we can discuss them. They may prefer having a nurse of the same gender. Ages 8 and up, we can trust them to give a reliable self-report of pain, although it's good to talk to them if we see any discrepancies. It's good to, between what we observe and what they're saying, it's good to talk to them, but generally we trust them to give a good report, an accurate pain scale report, and it's always important to explain procedures beforehand at their level of understanding. Okay, so now let's talk about those issues. School refusal is, we want to treat whatever their underlying phobia is. If it's a fear of a bully, we want to address that. If it's a fear of, if they are embarrassed because they can't read very well, we want to address that. So if it's anxiety, we want to address that. So one of the best treatments is cognitive behavioral therapy, where we try to help them to learn how to relax and kind of use the help shut their anxiety, their brain spinning in negative direction, just try to help them refocus things more positively. So that's relaxation and having set routines, just so that they don't have to think about it and make a decision every day if they're going to go into school or not. Just make it part of the routine that they automatically just know that when they get up, they go to school. And then encourage them gently into returning to school and help them to feel supported. And then we also, to help us to know what the underlying cause of the phobia is, we look at the functions of school refusal. And there's basically 4. So one is avoiding negative stimuli. This is where they feel embarrassed or frightened or shy because they, for example, the example I gave earlier, they can't read and they don't want to be called on in class to read in front of their peers. The second one is avoid social situations such as bullying. The third one is attention from caregivers. So they shouldn't be getting special attention while they're staying home from school, because that, like getting to do special things and and the fourth one, positive reinforcements. So anytime they stay home from school, it should be more business-like, matter of fact, so they don't have to get the added benefits that these functions are providing. Okay, so TV and media. Zoom in a little more. Children who spend excessive time on media, whether it's television or video games or whatever, are at increased risk of these four things listed here: obesity due to decreased physical activity, depression due to dopamine effects, impaired communication and social interactions due to diminished interactions with others, including their family, and then addiction to electronics. Again, that's related to the dopamine that's released. Okay, latchkey children. These are the children who are left home with unsupervised for a portion of the day, and this isn't necessarily a bad thing. In fact, it can be good if the parents help to prepare them well and give them the feeling that they are trusted and know they can be responsible. However, that preparation is the key. You have to prepare the child by giving them emergency contact information, and also by prearranging with another nearby adult who can step in if there's a problem. Teach them safety rules, give them assignments that they should be doing, so that they have a sense of guidance or direction when they're not supervised. And let's see, I think those go somewhere else. Anyway, I think I cut and paste and made it in a little error that those don't go with cyberbullying. Okay, so, but those first up through arranging for a nearby adult does apply to latchkey. Okay, then the next issue we're talking about is stealing, lying, cheating. School-age children are motivated to do these things because they want to look, they feel like it improves their image, helps them look better. So they need to be taught to self-regulate, to control their behaviors, and that they can have a better sense of a better self-concept if they know that they can be trusted and that other people trust them and respect them. So encourage them to have impulse control and avoid shaming them. We do want to teach them to do the right thing, but we don't want to do it in a way that shames them. Bullying. So signs and symptoms of bullying are mood swings, bruises. They come home hungry because they gave their lunch got stolen or something like that. Missing belongings, again, because they got taken away. And it's good to know that teasing is bullying. It's not an insignificant thing, because that's somebody making fun at somebody else's expense. Then moving on to substance use by school-age children. Children are at greatest risk for substance abuse. For damage, the younger they are when they are exposed to substances, the more harmful it is to their body. And those children who are at greatest risk are the ones who are more tempted to succumb to peer pressure, those who suffer from low self-esteem, those who have easy accessibility to substances, and those who see it the example of using substances in their home. Those kind of go hand in hand. So if they're seeing it in their home, usually they have access to it in their home, and they're more likely to use. Also, those children who desire to escape reality and, oh, yeah, I already said that. Okay, sex education for the school-age child is to help them to develop a more positive attitude toward their own bodies and towards their gender, and to know to be respectful of other people's and other people's bodies, etc. Obesity, this is usually due to poor eating habits, genetics, or lifestyle with limited physical activity. Also can be related to poor nutrition, social pressures. Obesity management is the most important thing is to get the parents on board by encouraging them to provide healthy meals, teach healthy eating habits, encourage healthy physical activity, which is actually very beneficial for not just the child but the whole family. So they should work on improving their health as a family and not just target the one obese child. Street safety. So when anything is with wheels is involved, like rollerblading, biking, skateboarding, they always need to be wearing their helmet. Teach children about stranger danger to know that they're prepared to know how to respond if somebody approaches them, and that they can know not to, no matter how nice a person it seems to be, unless they personally know them and the family knows them, they should not be trusted. They should always clear with their parents before they trust anyone. Unfortunately, that's just the way our society is at the present. And also, they need to be aware that this includes people they meet on the internet. Look both ways before crossing the street. If they're out with friends, they need to be taught to stay together, stay in a group, and not to wander. Just know exactly where they're going and go straight there, not to wander. And wandering increases exposure to being targeted. And also avoid using headphones, because that also helps them to be less aware of what's going on around them. And they should stick to familiar areas and not to go to areas where they're not familiar. Car safety. So MVAs are the motor vehicle accidents are the leading cause of death for this age group. And all children who outgrow their forward-facing car seats need to move up to a booster seat, because that helps the seatbelt fit appropriately, which, by the way, the shoulder strap needs to go across the chest, not cutting into the neck, and the lap belt needs to go across the upper thighs, not over the abdomen. They need to continue to use a booster seat until the seat belt fits them correctly. And all children under 13 should ride in the back seat, if at all possible. Water safety. Teach children how to swim. Children should never swim alone. They always should have a buddy, and there should be some adult supervision nearby. Only dive into water approved for diving. So they should not dive into shallow water, because they could get a head injury. If they have fair skin, they should wear skin protection, sunscreen, and no running or horseplay around the pool so they don't fall and crack their head. And they should know not to swim in canals or waters with unknown currents. Okay, so that is it for school age. Please, if anybody has any questions, type them in the chat box, or just come on mic and let me know. Okay, so now we're going to go back to the growth and development table. This time we're going to look at the adolescent one. Okay, so for physical growth and development, remember the school age ended with a growth spurt. Well, adolescence starts with that same growth spurt. So that the growth spurt is kind of like the dividing line between finishing up with school age and starting up with adolescence. So pubescence begins with the growth spurt, and girls' growth spurt happens about 2 years before the boys' growth spurt does. And the pituitary gland secretes the sex hormones. Adolescence, let's see, generally begins about 2 years after puberty. So I think actually, let's look at this. Oh, let me find it. Oh, it's here. Okay. And you've got this in one of your slides. So adolescence is divided into these 3 stages: early, middle, and late. Early adolescence is pretty much the same as puberty or pubescence. So it lasts an average of 2 years, and it begins with the dramatic growth spurts and ends with the reproductive maturity. And that is when middle adolescence begins. And that, which is the definition of reproductive maturity, is menarche, or onset of menstruation for the females, and sperm production for the males. At this point, they are now capable of abstract thinking and also susceptible to mood swings. And a lot of that has to do with the raging hormones. And then late adolescence starts with the end. Late adolescence ends with the cessation of growth. So that's why the age is a little older than what we generally think of as the adolescence. It just ends when they reach their full height. Okay, so that is that section. Okay, let's talk about their gross motor skills. Remember, their large muscles mature and grow faster ahead of the smaller muscles. So there is a period of temporary, what you see in bold in here, decreased coordination, which is just temporary until the small muscles catch up with the growth of the larger muscles. And that's why this age group, it seems like a lot of times they're kind of klutzy, and that's because of that. So fine motor is they have greatly improved dexterity. And Erikson's stage for this age group is identity versus role confusion. So remember, we want to keep these straight. Psychosocial, Erikson's stage for school age is industry versus inferiority. And adolescence is identity versus role confusion, because they're really figuring out who they are as a unique individual, and not just being part of their family unit. Let's see, they are super concerned about their appearance at this age. They seek group acceptance. They push away from their family influences, but they still need family support and unconditional love. For cognitive development, this is Piaget. They enter the formal operational stage. That is the highest stage of Piaget's stages. And it's formal operations because now finally they can think abstractly. They can think of hypothetical situations. So you can remember that story that we saw in the video about just what would happen if if there were no more children, if children stopped being born into the world. And so that's just or where would you put a third eye? Let's see. Oh, Shelby, to answer your question, this chart is under Unit 11. Um, it's it's way back under Unit 11 because it's called the Growth and Development chart, or the Growth and Development table. Oh, maybe you were asking about the other chart. So this is under Unit 11 for the under Growth and Development table, and this chart. This is in the slide. I don't have that separate. So you have this in your adolescent slide. It's towards the start of the slides. Let's see. Sorry, I'm looking at my cheat sheet. So about back to Piaget's formal operational stage abstract thinking and hypothetical situations. So just remember that, keep that straight. And then for Kohlberg's, they may possibly enter stage, no, they will enter stage 4, which is respect for authority. And then this is the optional one, the post-conventional stage. That one, only about 20% of the population enters this stage, but where they have higher moral standards. And let's see, they develop their own set of morals through discussion and empathy. So that discussion piece is super important because they really need to talk things through to help process, to help them figure out what their beliefs are, because they want to believe because it's what they own and not just because it's what somebody else taught them to believe, whether it be a parent or a teacher or a mentor. They've really got to own it by processing and discussing. Discipline throughout adolescence. It's important that they buy into the discipline so that they will respect the authority, that they'll respect the rules, and so you need to make the rules and expectations clear to them, but also listen to their viewpoint so that they feel like they're heard, and that way if they feel like they're respected, they're more likely to respect the authority of the person who's showing them respect. Let's see, nutrition. Make sure they get plenty of calcium. Calcium is one of the, it's hard for them to get enough calcium because they use so much of it at this age, and their body is using more calcium in adolescence than at any other point in their life. And they can get calcium through dairy products as well as green leafy vegetables. Okay, comfort issues. Again, this is what a nurse would provide for a hospitalized adolescent. We want to invite, give them as much privacy as they can because that's super important to them. Also, we can often get more information out of them if we talk to them privately without the parent present. So we do try to invite the parent to leave for at least part of the interview or examination. They're very concerned about their body image, and again, you always want to explain things to them and respect that they are part of the decision-making process. It's not just between the caregiver, the healthcare providers, and the parents or caregivers. We really include the adolescent in part of the decision-making process. Okay, now let's go back to that, the issues. So We teach maturation education to help, especially for girls, since they have such a major change with the menstruation. We want to help them to have a positive experience with that, and also the boys as well. We want them to be educated so they know what to expect also. Depression is a major issue. It's an overwhelming feeling of sadness. Like I said today, sometimes depression is experienced as anger and not so much sadness. So it can be both sadness and anger. Females, up until they're menopausal, females tend to experience depression as sadness, whereas males tend to experience depression as anger. But they both can experience both. And the causes of depression are overwhelming demands placed on the teen, which include things like school and work, demands from school and work, and also complicated relationships with their peers and families. And even though they've spent their life with their family, their relationships really change because they're pushing away from their family at the same time they have still have the dependence on their family. And then they tend to be very self-reflective and comparing themselves to other people and feeling like they don't measure up. And so they kind of can give them feelings of disappointment and despair. Suicide warnings are poor school or work performance, lack of interest in things that previously they really enjoyed doing, disturbance in sleep or appetite, giving away their possessions, and expressions of suicidal thoughts. Substance use, alcohol. We spent quite a bit of time talking about different substance abuse issues. And remember that non-oral alcoholic consumption is actually much worse than oral consumption because it bypasses the liver, and so it tends to be more toxic to the system. And alcohol, when it's combined with other things, especially any drugs, but a popular combination for teens is caffeine alcohol mixture. That is very bad. Even though it helps them to feel more alert, it actually does not improve their judgment at all. Gun safety. Store guns in a securely locked case. Keep the guns unloaded and the ammunition stored separately. Also use ear protection if they go out shooting. Gangs, a common reason why youth join gangs is to protect them from other gangs, or if they don't have a strong social, a strong family structure where they're being cared for by their family. Dating safety. Intoxication while dating is associated with increased risk for violence, so they need to be aware. Of course, we always encourage teens not to drink because underage drinking is illegal and it's very bad for the health of the teenagers. Dating violence has potentially long-term consequences because it can interfere with future relationships with the ability to trust future relationships. And stalking is a form of dating violence. It's not benign at all. Not that anyone would think it was, but motor vehicle safety, teens are really comfortable with taking risks because they feel kind of invincible. They feel like nothing bad is going to happen to them, and they feel like they're in control, so they're more likely to do risky things like text while driving or driving while intoxicated. So this is a major issue for teenagers. Water safety. If they go out boating in open water, they need to wear a life jacket at all times. It's not good enough just to have the life jackets handy in the boat if they need them. They need to be wearing them. Never drink while boating. There's no such thing as a designated driver while in the boat because everyone needs to be sober in the water. And always swim with a buddy and let someone know where they're going. Nursing implications for teens. So when you're working with teens, you want to detect and address any adolescent problems to kind of nip them in the bud early, and that will help to prevent a lifetime of disadvantages. So we do want to minimize the effects of negative things going on in the teen years. So really encourage healthy relationships, healthy behaviors. If teens have questions, listen therapeutically. Really listen. Clarify their concerns. Don't be dismissive of their concerns, because if they voice a concern, you know it's really significant, because teens aren't ones to really open up that much to healthcare providers generally. And take in a history, ask about the following in a non-judgmental manner, if they have, and so that they're more likely to open up. If they use alcohol, and include specifically ask if they use non-oral routes of alcohol, because they're likely to say they don't use it because they think it doesn't count if it's non-oral. Ask about substance misuse, sexual activity, and all of these things we want to ask about whether we suspect it's going on or not. So don't just look at them and say, you look like a kid who wouldn't be involved with these things, and skip over it. You can't make that assumption. So always ask. Provide patient education regarding risks of non-oral routes of alcohol consumption, substance misuse, and risky behavior, again, regardless of whether a problem is identified or not. Support them in believing that they can change and that they can choose and carry out a plan. Don't make them feel like they can't function without somebody holding their hand through the change. Help them to feel empowered, but give them support, offer them guidance. Don't force it on them, but because they're likely to push back if you try to force anything. But that's why it's important to be non-judgmental and welcoming, and really hear what their concerns are, and emphasize their choices may have life-changing consequences. That's it for that. Okay, let's go ahead and do our practice exam. Okay. When developing rapport with a new adolescent client, it is important for the nurse to use which approach? A, consistently give honest information. B, have the parents present if at all possible. C, use jargon when communicating with the teen. Or D, allow the adolescent to smoke if desired during the conversation. Okay, I'm going to publish it, but I think I'm the only one who's going to see it. So everyone got that one right. Which is A, consistently give honest information. Okay, the next one. The nurse, let me publish the poll for you. Oops. Give you the polling option. Okay, the nurse should explain that adolescents are at greater risk for contracting STIs due to which factor? A, their immune system. The immune system of an adolescent is immature. B, untreated urinary tract infections will develop into an STI. C, adolescents are risk takers and believe they are invincible. Or D, adolescents often lack parental supervision. Okay, so that one, that again, Almost everyone got this one right, which is they're risk takers. Uh, we did have some choose option A. Their immune system is really functional by this age, so it's not really considered to be immature as adolescents. It's more that they engage in risky behaviors. Oh, the top got it cut off of this one. Let's see. Okay, this says the parents of a 12-year-old ask why their non-sexually active child should receive the human papillomavirus vaccine. What should the nurse tell them? A, the vaccine is most effective against cancer if given before adolescence. B, parents are never sure when their child might become sexually active. C, HPV is most common in teens and women in their late 20s. Or D, if your daughter is sexually assaulted, she may be exposed to HPV. All right. So about 2/3 of you got this one right, and those who didn't get it right were evenly divided between B and D. So let me go over that. So the vaccine is most effective when given before adolescence. So it's most effective when it's given between like 9 and 12 years of age. It is the older a person is when they get the vaccine, the less effective it is. It is true that B and D are definitely both true options. However, the A is generally speaking the most true. That's what's kind of hard about some of these NCLEX exam questions is they have multiple right answers, and so you have to choose what the best answer is. And even though it could be true that they become sexually active without the parent being aware, or they could be at risk for assault, parents are more, if you give those answer to parents, they're more likely to say, not my kid, or I'm going to keep my kid protected. My kid and I have an amazingly open line of communication. My child would tell me anyway, so that there's the possibility that they could think it doesn't apply to them. But A, that is a universal truth, that no matter what, it's true, and it's actually the reason why we encourage kids to be vaccinated between 9 and 12. All right, next option. Okay, parents of a 14-year-old boy report his 13-year-old sister is 2 inches taller than he is. What should the nurse advise them? A, their son should be evaluated for growth deficit. B, their daughter should be evaluated for abnormal growth. C, boys' growth spurt is 2 years before the girls. Or D, girls' growth spurt is 2 years before boys. And everybody's getting this one. Good job. Just giving you confidence that you guys mostly are getting all the right answers. Okay, so next one. Parents of a 15-year-old state their child is moody and rude. What should the nurse advise? A, restrict the teen's activities. B, discuss their feelings with their teen. C, obtain family counseling. Or D, schedule their teen for private counseling. And once again, you guys are all getting it right. So that is to discuss their feelings with their teen, because moodiness is just part of really normal for this age, and you would want to just help them to be aware of the impact their mood has on those around them, and talk it through with them. Okay, next one. The nurse explains the onset of adolescence occurs at which time? A, same age for both boys and girls. B, 2 years earlier in boys than in girls. C, 2 years earlier in girls than in boys. Or D, completely variable time frame. So the responses are coming in a little slower on this one, and it's interesting because the division is pretty equal between A, C, and D, although C is pulling ahead, which is good because that is our correct answer. So about 3/5 of you chose the right answer, and a fifth option A, and another fifth option D. So let's talk about that. It is just like the girls have their growth spurt earlier. They move their growth spurt is the onset of puberty, and puberty is roughly 2 years. And so if they start the puberty or that growth spurt earlier, they're going to finish up with it earlier and move into adolescence earlier. So it does begin 2 years earlier in girls than in boys. It is variable because even among girls, there's a wide range. Some girls start much younger than other girls. So there is a wide variability, but overall, it can be clearly seen the pattern where it tends to be 2 years earlier in girls than in boys. There's not one quite that tricky on the exam tomorrow. Okay, next question. Okay, parents express to the nurse their frustration with the amount of time their teens spend in front of the mirror. The nurse explains this represents which? Narcissism, procrastination, testing boundaries, or developing self-concept? I think this is our last one. And you guys are 100%. You all got this one. Well, just as I said that, there were a couple of other choices made. So let's talk about those. So narcissism, it can be argued that teens are a little bit egocentric, not in like Piaget, not in the Piaget developmental thing, where just they tend to be inward focused. So and part of their developmental stage is, so it's a normal part of their developmental stage to be concerned about their appearance and concerned about what peers think of them, how they fit in. So it's not considered like to be pathologic like narcissism is. So it's just a developmental stage. And then the other one that was chosen was testing boundaries. It's true, teens do that a little bit, but we tend to think of just their concern about their self-image as more of a developmental stage. Okay, let's see. Yep, that was our last one. All right. So I'm just reading Megan's comment now. Oh, wait, Shelby's. Yeah, you found one of the slides. I was just wondering where I could find the complete way. Yeah, the one on the slides is the same. If you can just go in and copy it and add it to your notes, I guess that's how I pulled that one out and put it in the notes. I just went into your slide and copied it and plugged it into that note page. So that should be easy to do. Does it look like, oh, there was one thing I added. Yes, I did add mood swings to that. Since the one that I published on your screen, on your PowerPoint, I did add just the one item, which is including the fact that they experience mood swings, and that's a normal part of teenage behavior. And everything else should be the same on it. And let's see, Megan, I guess I didn't choose. Oh, right, yeah. That's true. Sometimes when you're reading a test question, don't overthink it. And that's an example of kind of overthinking something. So looking for more, not seeing the detail you expect to see. So thinking it's wrong. So if you're reading a question and it doesn't give as much detail as you think it should, just kind of pull back and say, but does it still apply? And then figure out if it still applies without that added amount of detail that you were looking for. Okay, any other questions? This is just over 2 units, so it is a little bit simpler review. We still spent almost an hour on it, but I think if anybody has any more questions, let me know now. Otherwise, I'll close this out. Or if you think of something later, just message me. After 4:30, I won't see email set on Canvas or to my work. So if you have any questions after 4:30, text me. All right, thanks. Good luck with your studies. Good luck on the test tomorrow. I'm pulling for you. Good. Oh, and I'll see if I can post a little study guide like I did last week, although I really covered the tables are essentially your study guide, but I'll look and see if there's anything else I can help you with. Okay, thanks. Bye. Oh, and did you guys see that the discussion, is this discussion board available? I had okay, good. For some reason it didn't automatically publish when I opened it, when I posted it. So thanks to Amy for letting me know it wasn't up. See ya.